It's exciting to be able to follow up with the developments that we have had in Iceland, but it's really, really interesting to hear that we are doing more things within the Nordic countries when it comes to promoting mental health in our school systems. So I'm going to tell you a little bit about developments that have been sort of ongoing in Iceland for the past 5, 6, 7 years, really, if we count all the way back, in terms of strengthening our school system to make it more of a stronger venue for promoting mental health among students. And this is something that we focused a lot on in our last action plan. So this was a focus among the things that we addressed in our last national mental health policy and action plan, where we were focusing on the school system as a venue for mental health promotion, which is based on 2 premises. First, that mental health is created and developed in our everyday life. So it's not something that we create in hospitals or healthcare settings, but it's something that develops in our everyday settings. And the foundation for good mental health is laid in youth. So this is the time where we have a really good chance to intervene with things that can strengthen and improve our nation's mental health during childhood. So that's why we consider schools to be the optimal venue for youth mental health promotion and prevention, because this is really the only area where we can find all children and adolescents in society. We also know that difficulties in behavior, emotional and social skills negatively affect learning at an individual level. So it's not just a question of public health or mental health, it's also a question of education. And we also know that bullying and behavior problems negatively affect learning and school climate at the school level. So it's not something that only affects an individual child, but it affects everybody and contributes to lower job satisfaction, staff turnover, and burnout among teachers and staff. So it's really everybody's best interest to focus on this in schools. And so when we were sort of forming the school system as a venue for mental health promotion, prevention, and support, we are not talking about changing the school system into a well-being institutions or part of the healthcare services, but we are focusing on the upper area in this river of life, where we are teaching the skills, social and emotional skills that are necessary for good mental health. We are providing necessary support for those who have trouble in adapting those skills, and we are also catching the ones that, despite our best efforts, are not managing well. So in Iceland, we do teach children how to swim in our school system. And so it's about time that we teach them these necessary life skills in a systematic manner as well. So social and emotional learning is the process through which children and adults, of course, also come to understand and manage their emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and make responsible decisions. So these are sort of the core elements that are involved when it comes to promoting social and emotional skills. We also know from research now that there is so much to gain when we do this effectively within the school system. So meta-analysis have shown that when we focus on effective and sustained teaching of social emotional skills, we are likely to see a positive change in student behavior, increased social and emotional skills, increased academic performance, which is a really big concern in the Icelandic education system. So it's not, like I said in the beginning, it's not just about feeling better. It's also about improving our general school work. We can reduce the risk for alcohol and substance use, and the effects of this have been shown to last for 6 months and up to 18 years. So it's a really, really good chance that we have within the education system to address these factors. The development in the literature has been increasingly towards this kind of systematic way of working when it comes to promoting social, emotional, behavioral, and also academic skills through this multi-tiered systems of support, where we are really making use of the public health model in general, where we try to always be like the picture of the river of life showed. We are trying to move upstream. So before any kind of problems occur, we want to teach effective skills. We want to make sure that we're doing everything we can to have the children behaving, feeling, and functioning well. And only then can we sort of begin to look if there are any kind of problems, because we know that if we are not, for example, managing behavior in schools well or according to evidence-based practices at the general level, we are more likely to see problem behaviors. So this is sort of the way that it's organized, where we focus on doing really, really well on the first level to promote positive school climate, quality education, and these kinds of skills that we have discussed. And then if the children are still, some of them, and they will, some of them, despite very good teaching, they will, for example, show signs of reading difficulties or behavioral or social difficulties. And that's where we want to meet them with very easy to access support. That doesn't long-standing assessments or anything like that, but it's ready at the school where we can just intervene with a simple boost to help them. And if that doesn't work, then we would go on to a more detailed assessment. This kind of model also involves a higher emphasis on using evidence-based practices to always be monitoring progress, make decisions based on information and data, and to have a focus on multidisciplinary collaboration and teamwork. So just a little bit about Iceland. We are a very, we are not necessarily in the geographical sense a very small country. We are an island about 100,000 square kilometers, but we only have about less than 400,000 people to inhabit all this space. The majority of Iceland is uninhabitable, sort of in the middle, so the population is spread around the coastline. And amazingly, we have about 70 municipalities for this very small number of people. We have 260 preschools, 174 compulsory schools, and 30 upper secondary schools. So the National Mental Health Policy and Action Plan that I mentioned at the beginning here was among the looking at reviewing the status of mental health promotion in Icelandic schools across educational levels, so pre-primary and secondary schools, was among the focus in this policy and action plan, where a task group was formed that was tasked to look at, are we using evidence-based practices in schools in this area, and are we meeting young people's needs for support? In creating this in this work, we collaborated a lot with teachers, principals, and other school staff, where we formed a national survey, which was really, really large scale. It was contained around over 100 items, took about 2 or 3 hours to answer. And we asked the principals in all of the preschools, primary and secondary schools in the entire country to form a team within the school to answer the survey together. So we wanted to have a few teachers and also a few of the support staff, so guidance counselors, special education teachers, school psychologists, things like that, to come together and agree upon one answer for each question. So we wanted to have each answer from the school reflect a wide a wide angle, so to speak, that really reflects how things are done in the school on a daily basis. We looked at the scientific literature on school mental health promotion, prevention and early intervention. We looked at the available national and international guidelines, indicator of effective practice and resources. And even though this was so heavily demanding of the resources within the school in terms of time and people to answer the survey, we still got all of the secondary schools in the country, and we got around 70% of the primary and preschools, which was really, really good, and gave us a lot of useful information about how things are really working in our school system. So we asked about these 10 key components of school mental health promotion, school policy and practices, the school environment, staff capacity building. So this is around how are we in a systematic manner increasing knowledge and skills among teachers and school staff in this area. Student equality and participation, school connectedness, social emotional learning. How are we sort of in a direct way teaching these skills to children? Behavior policy and support, assessment and student support, and collaboration with both support services and with parents. So just a quick overview of our findings. As you can see, where we asked about sort of the structural factors in our school system. So if the schools had developed a policy or a school vision on promoting social emotional skills, promoting mental health, etc. If they had an implementation strategy in place, if they had really the infrastructure within the school, for example, they had defined work procedures, they had effective teamwork, things like that. And if they were keeping track of if the staff was really working in this manner, if for example, if the school had a behavior policy, is the staff following this kind of procedure? There you can see that the numbers were really, really low. This is the percentage of schools that said, yes, we are doing this. When we asked about the simple things like the physical environment, when I say simple, I mean that it doesn't require necessarily a very complex strategy. It just means that you have to have the space. Okay. We can also see that for the preschools and the primary schools, we got really, really bad numbers. For example, when we asked the staff, are you able to minimize disruption among the children in class? Do you have the possibility of dividing them into smaller groups if you need to? The numbers were really, really low. Only about, for example, in the primary school, which is a compulsory school level in Iceland, less than a third said that they were able to do this. Also, when we asked about if the air quality and the noise level was okay in the school, really low numbers there as well. And then a high number for staff turnover and staff shortage. So this is an environment that is likely to cause a lot of stress and strain on the individuals in this kind of settings. So that's a problem as well. We asked about if the staff was receiving any regular training when it comes to evidence-based support for behavior among students and classroom management. And there we also saw really low numbers. So that's not really a very common practice in our school system to offer teachers and staff regular training in this area. When we asked about the social emotional learning, we also saw that the preschool level was focusing much more on this than the older school levels. And when we asked about, as you can see on the far left side, if the schools had a coordinated strategy around this kind of teaching, if they had defined if they had defined goals for this teaching in their school curriculum, we saw that less than half of the primary schools and a much lower part of the secondary schools had really done this. And likewise, when we asked about if they are teaching the students in a systematic manner, emotional skills, problem solving, friendship skills, relaxation skills, things like that, we saw that around 50% or even much lower were doing this in their schools. When it came to behavior support, we also found that there was a lot of area for improvement. And even when we asked them, do you use praise, which is a really, really simple way of trying to promote the kind of behavior that you would like to see more of among children. In the primary schools, for example, as you can see on the far right side, only about 60% of the primary schools in the country said, yes, we do that to try to elicit the kind of behavior we'd like to see among children, to just praise them when they're doing good. Also, when we asked about functional assessment, so the functional behavioral assessment is an evidence-based practice that is recommended when a child shows increasing or repeated behavior difficulties. It is a systematic way of finding out what is it in the environment that is eliciting this kind of behavior and what can we do about it. And problem behavior is a really, really, really big problem in Iceland, where it's one of the things that teachers talk most about when they talk about difficulties in their work. It's contributing to staff turnover and burnout, and of course, children who exhibit problematic behavior are also an at-risk group themselves. So it's a really important area. So it was not good to see that we are not using evidence-based practices in the manner that we should be doing in our system. Also, very concerning was when we asked the staff, do you receive, in your opinion, adequate support that you need to be able to manage student emotional difficulties, social difficulties, behavior difficulties, violence and trauma? As you can see, the numbers for especially the primary school level, they were around 50% or much lower than 50%. So 41%, 40%, 46%, where they feel that they are getting enough support. So we saw that there were a lot of areas that needed to be improved if we were going to strengthen the school as a venue for mental health promotion, prevention, and support. So this task group that I mentioned earlier, that was given the assignment to look at the school system and see where we can do better. This task group delivered around 40 actions to the government that were organized in these 8 different categories. We need to more systematically foster social and emotional learning from preschool and throughout the entire education system to upper secondary school. We need to do this in a form of multi-tiered systems of support. We need to increase cross-sectoral collaboration for the benefit of children and youth. We need to make amendments to the school environment so that it better supports the well-being of both the children and the staff, to increase teacher and staff capacity when it comes to children's behavior, mental well-being, and social skills, to make sure that we are always using evidence-based, proactive, and child-friendly behavior support, foster school connectedness and collaboration with families, and to legally ensure children's rights to quality education and evidence-based support. So some of the tasks that we have ahead of us now, in 2020, this action plan was approved by the government, and just this year, the Minister for Children and Education in Iceland incorporated this strategy and made that among the assignments that this ministry is going to work on in the coming months and years. And this will involve a lot of really big changes, really, and developments. So, for example, to revise the national curricula to include social and emotional learning as an independent subject, to revise teacher education to include a stronger focus on inclusive evidence-based practices for students' social, emotional, and behavioral learning. We also have one of the action plans, or one of the action points, is to offer a specialization in teacher education where you could graduate as a mental well-being teacher, just like you could graduate as a physical education teacher. We are preparing a new national legislation on school support services, guided by the Inclusive School Model and the UN Convention on the Rights of the Child, where we want to strengthen the support services around children and of the staff, of course, because they are the key to student well-being in the school. And there's also a plan to form a new government agency to support implementation, evidence-based practices, quality instruction, assessment and progress monitoring in the schools, school development, staff training, etc. So these are just a few of the sort of major developments that we have ahead of us. We are looking at this not in terms of weeks or months, but this is going to take many years to implement. It's going to be done like my Norwegian, the Norwegian presenters before me mentioned, in a stepped fashion. So we can't do everything at once, but we are looking at sort of the following decade as the time that we are focusing on in terms of implementation. We know that in Iceland, as in many other countries, mental health is one of the most pressing concerns that we have ahead of us in terms of the nation's well-being and prosperity. We also know that education is the most effective means that society possesses for confronting the challenges of the future. And so we want to work with the school venue as the tool, one of the most important tools that we have in shaping the world of tomorrow. Thank you.